So now I'll just introduce our next speaker who is joining us online again, and it is Dr. Maria Neira. Welcome, Dr. Neira. I suppose I'll just introduce Dr. Neira is the Director of the Department of Environment, Climate Change and Health at the World Health Organization in Switzerland. And she's been in that position since September of 2005. Dr. Neira has a background in medical coordination with refugees, with Médecins Sans Frontières. She also has many skills that link and reinforce the health aspects and the health impacts of air quality. And I suppose the key that we're hoping that she touches upon is the World Health Organization in late 2021 introduced the new, more ambitious, I suppose maybe is the word to use, air quality guidelines. So it'd be interesting to hear from Dr. Neira, and as I say, if people do have questions, do continue to put them up on Slido. Dr. Neira, when you're ready, please.
Thank you. Thank you very much, and good morning from Geneva. Really sorry that I cannot be with you. I'm really delighted to join you because one of my favorite topics is to talk about clean air. So I cannot be more happy to have this opportunity to share that with you. I hope you can hear me properly. Proving that technology is always challenging you. Just 1 minute ago, my laptop collapsed, saying that he needs to restart. And fortunately, I was able to move to an iPad. So technology is challenging us, but hopefully we can adapt to the new situations. As I say, thank you very much for this opportunity. I'm really pleased to see what Ireland is doing. And count on me to make sure that the good progress you are having or you will be having needs to be used at international level. And you need to be as a kind of champion to stimulate others to go into this road, which is very ambitious, but at the same time, the road of common sense and a good protection of people's health. Let me maybe start with the global picture. You were describing extremely well what is the situation regarding air pollution and why do we need to move on a more ambitious strategy on clean air. But globally, every year we still have 7 million premature deaths that are associated with exposure to air pollution. And this, you will agree with me, this is totally unacceptable. How can we in 2022 still have 7 million premature deaths around the world caused by exposure to the bad quality of the air we breathe? We heard already a couple of times, there is a resolution of the UN General Assembly telling us that there is a human right to a clean, safe and healthy environment. Means we have the right to breathe clean air. But my question to all of us is, do we really need still in 2022 declare that we need the right to clean air? Of course we need the right to clean air and to clean water, safe water and food. If not, what it will be our basic human rights. But here we are at the COP27 as well, the right to a clean, healthy and sustainable environment was recognized. And it's good, it gives us again a very strong message to our citizens. But again, it makes us think that until now, we didn't have the right to breathe clean air. Let me, on the global picture, let me put on the table as well the fact that not only we have 7 million premature deaths every year, we are having many chronic diseases that are making our hospitals full of patients. The suffering caused by exposure to air pollution and the diseases that are caused by exposure to air pollution are very well known now. Most of them are the so-called non-communicable diseases, so chronic diseases that will require a long treatment, a big expenditure in our health systems, of course, as I mentioned before, a very important human suffering. Not only we have respiratory diseases, which are the most traditionally described as associated with air pollution, lung cancer, even pneumonia, acute infectious diseases, of course, asthma and other obstructive chronic pulmonary diseases. But in addition to that, we know that those PM 2.5 particles, the very teeny ones, they go to our respiratory system, but from there, they can reach our bloodstream, and from there, they can go to any organ in our body, causing a terrible damage. Stroke, of course, ischemic heart disease, in addition to the respiratory diseases. And now we are accumulating evidence about the impact of air pollution in our brain, putting at risk our cognitive development, putting at risk even the health of our children before they are born, even when they are, the placenta can transport those teeny particles, and there are no barriers for all of them. So I think that if people ask, is air pollution a massive, critical public health issue? The answer is yes, definitely. Probably one of the biggest public health issues we have been confronting in the last decades. Now, what next? What are the prescriptions? What can we do? How can we move from there, and what are the opportunities? Let me try to summarize what I think are the good opportunities and prescriptions we can propose. The first one is that we have the tools, we have the scientific evidence, more than 70,000 scientific publications, so no controversy, enormous amount of scientific evidence demonstrating the impact of air pollution on our health. So no need, I mean, obviously research is always important, but we have more than enough weight of evidence to accelerate and move to a different level of ambition and speed on responding to the magnitude of the health problem that air pollution represents. Is this the case at the moment? No. We don't have the response in terms of fighting air pollution that will be the proportionate one, the adequate one, responding to the level, the magnitude of the public health issue we are dealing with. Therefore, we need to accelerate. So where do we need to accelerate? Is COP, and in this case, COP27, a way to accelerate our work to tackle the causes of air pollution? Definitely, yes. As very well stated by the Minister and the Director General of EPA, the same causes that are responsible for the global warming on a big percentage are responsible as well for the pollution of the air we breathe, which is the combustion of fossil fuels. Unfortunately, COP27 was not ambitious enough, and again, not because of lack of evidence, because everybody was in agreement, all the presentations, the events, the panels, the discussions were moving into that direction. How the combustion of fossil fuels is responsible for climate change and at the same time responsible for air pollution and the massive damage that is causing to our human health. So yes, COPs are one of the big tools, big political opportunities, conferences and member states are meeting there. They should take a more ambitious action on that. And the health argument is probably the one that will be able to accelerate that level of ambition. If our citizens realize that the clear connection between their health and the causes of climate change and air pollution, probably they will use that to put more pressure on their politicians, on their policy makers and leaders to accelerate this transition to renewable, clean sources of energy. And never before the issue of access to clean energy has been a public health issue as it is now. So the first prescription will be join forces with the climate change community. This overlap very much. Climate action will be extremely important for human health because they will be reducing air pollution, and we can reduce the 7 million premature deaths. Of course, many other health benefits will come out of the climate action, of tackling the causes of climate change. But let's focus on the possibility we will have to reduce by 80% the premature deaths caused by exposure to air pollution if we tackle the causes of air pollution. I think this is an incredible mission that will represent more than 5 million deaths per year that we could be part of the solution, the opportunity to reduce this horrible burden and death caused by air pollution. Second opportunity, the mayors, the local governance, definitely we need to associate with them and make sure that because they are closer to the citizens, because they need to be very much involved on the communication of the public transport system that they will put in place, because they will be the ones monitoring on a daily basis what is the quality of the air, and the citizens will put more pressure on them. I think an association with mayors and local municipalities is extremely important to create this positive message around how good will be for our health, for our economy, for our tackling the causes of climate change, for the green jobs that we can generate, how good it will be and how we can use that positive message to generate more action. Third prescription, the health professionals. More and more health professionals are not just happy to be at the hospital level, at the care level, providing the best possible care for our patients. Of course, this is our main mandate. We need to make sure that we treat our patients, we try to cure our patients, but as important as that will be making sure that people is not getting sick. And therefore, more and more we see pediatricians, any type of GPs, any type of specialized health professionals raising their voice and claiming that they don't want to keep treating an asthma patient and then send that patient back to the very polluted street where the patient was living before. So more and more, the health community, the health professionals are engaged on the environmental issues, on the energy issues. They were very vocal at COP27. It was a big participation of health professionals there. And this is extremely important for our cause because the credibility of the health professional it looks like it's still on the top of the ranking. And therefore, the voice of those medical doctors or health professionals at large is very respected. And therefore, we need to join forces as much as possible with our health professionals, looking for positive messages as well to our population, but explaining to them with the health argument why certain measures are put in place on a city, for instance, reducing the circulation of the private vehicles or the certain restrictions related to the use of energy or issues related to wood at home and chimneys or any of the measures we want to put in place to reduce air pollution can be better explained with the health argument and in positive, describing how many benefits will be generated from that intervention. And I think this association is critical. For prescription, I think it's four, it will be using law. I think maybe legislation can be one of the open roads for all of us. As you know, the recently released air quality guidelines, they were released in September last year. People say they are ambitious. My question to you is, what do you call ambition in public health? The level of ambition is never big enough when we are talking about public health. So, of course, we are ambitious. Of course, we want air quality guidelines, norms, and standards that will be the ones that will be protecting as much as possible the health of our people. So, yes, they are very ambitious. But as you know, they are not legally binding. We don't have the capacity to go as far as imposing those standards into any government or country. Therefore, in some places, and I'm sure you have been following what's happening in UK with the case of Ella Kisidebra, the little girl that passed away 10 years ago, and now 10 years later in her birth certificate, we recognize that the coroner recognized air pollution as the cause of death. I think this is new, this is unprecedented, but now others will follow. And I think we are moving into the no excuses. I don't think any politician will be able to say a few years from now, I didn't know that air pollution was a problem and was killing people. I think now it's very obvious, it has been very well stated. So the sooner we take those measures to protect people's health, the better from a legal point of view as well, to protect the decisions at the political level that were not big enough to protect our health. So legislation can be one of the ways to explore more ambitious targets and standards. The EU has launched the new standards. Unfortunately, they are not exactly the same as the WHO's ones, but we recognize a very good intention and very good steps. So we are keeping pushing for maybe later being even more ambitious. But for the time being, I think it's a very good step, a very good intention, and we need to keep making sure that this zero pollution strategy is put in place. Another prescription, the communication. Of course, is extremely important how we communicate. And I think we need to change a little bit the narrative and go back to the positive aspects on the communication. I think we need to combine the negative and the dramatic problem for public health caused by air pollution, but at the same time, we need to give positive, engaging, and motivating messages to our population. I'm sure you all know the Breathe Life campaign proposed by WHO in collaboration with UNEP, the environmental program at the UN. And what we are trying is to create a kind of positive competition among cities, among governments, who is doing what, how can we learn together, and what could be the step I can learn from another city and then putting it in place. But again, making sure that everybody understands how good it will be, the fantastic health benefits that we can obtain if we move and we accelerate on obtaining clean air for all of us. And on this campaign, again, we can mobilize the civil society is very much committed and understanding more and more the linkages with air pollution. The tools are there. This is the good thing. WHO can provide many tools on estimates of deaths and disease caused by exposure to air pollution. We have training material for health professionals. We have developed a course, of course, available to everyone who wants to use it, for training health professionals. We have many tools for mayors, for governments on how to advance on this agenda. And more than anything, we will be very happy to learn from you. How are you moving? What are the obstacles that you are confronting? And how your sample and your champion activities and the fantastic initiative you are putting in place is moving. We will be very happy to share that with others and to use you, if you allow us, as a good example, and hopefully being able to report very soon good and positive results of all of that. Our citizens will be the first to be benefiting from this, but our economy, our sustainable development, our capacity to generate jobs will be benefiting as well. And of course, we will be contributing on a very concrete and pragmatic way to tackle the causes of climate change. So all positive. What are we waiting for? Thank you very much for your attention. I hope it was not too long. Thank you.